got a lifetime of knowledge.
Let me call Mimi.
Is it freezing? How's it being back in?
It's actually not. The sun is shining. I mean, what is freezing? It's still 10 degrees outside, but at least the sun is out.
We'll take it. Yeah, we'll take it. Okay, we are back today with the pelvic floor. It's so funny. I was talking to Luke the other day and he was like, what are you guys recording this week? And I was like, we're doing what the fuck is the pelvic floor? And he was like, what is the pelvic floor? And I was like, I don't know, but
I don't know.
And then he was like, you guys do really niche topics like breastfeeding. And I was like, breastfeeding is arguably the widest reaching, most universal experience, quite literally on earth. He was like, it's so niche. I'm like,
so niche.
Breastfeeding.
Birth. So niche.
I was like, quite literally, it touches every person on earth.
I know.
Half the population and then some. Is so funny.
That's funny. Okay, wait. Okay. Yes. Welcome to Actual Experts. I'm Caitlin.
And I'm Lundie.
And we don't have all the answers, so we are going to ask the questions.
And today we are asking what the fuck is the pelvic floor to Dr. Sara Reardon, who is also known as the Vagina Whisperer.
Which we love. I love it. It's so good.
I found her on Instagram. Mm-hmm. And she has a really active Instagram and she's an author of a book. We'll get into it a little bit more, but I'm excited to learn from her. The pelvic floor has actually come up a few times in conversations with people being like, you should cover like gut health is one and the pelvic floor is another one. And I was like, I don't know anything about the pelvic floor and we're going to find out. We have lots of fun facts.
Okay.
Okay, we can get into it. The very first, well, let me start with the definition, then I'll get into some of the fun facts. Okay. So the definition, for those who do not know, myself included, is the pelvic floor is a hammock-shaped sheet of muscles and ligaments stretching from the pubic bone to the tailbone, forming the base of the pelvis to support organs like the bladder, bowel, and uterus.
So do boys have it too?
That was my next question. Yes. Men also have a pelvic floor. That was my first misconception. I was like, okay,
so not niche, Luke. You have one too.
That's exactly what I said. I was like, well, actually, you have one, so you should listen, so you know. Yeah. And I said to him, I was like, don't you hear how this is my only thing that I think I know about the pelvic floor is I'm like, when moms say that they laugh when they pee because like their pelvic floor is weak after they give birth, and Luke was like, no, I'd never heard that before.
Again.
Never heard that before.
Just the disconnect between men and women. I think I actually had the same conversation with Steven so recently because we were talking about Kegels. And I was like, I think Kegels are involved in this. And I was like, yeah, you do it so you don't pee when you get older. And he was like, what are you talking about? And I was like, I remember my mom and her girlfriend jumping on a trampoline when we were at school and laughing because every time they jumped, they would pee a little after giving birth. Like, it's a thing.
It's a thing. I know. The things that women have to worry about. So yes, we'll get into that. That's another one of my fun facts. So men also have a pelvic floor. Weakness or tension in these muscles can cause incontinence. Incontinence? Is that how you pronounce it? I think you can't get it. You can't get hard. Incontinence. Okay, we're gonna go with that.
Yeah.
Erectile dysfunction. What's the difference between those two? And pelvic pain. What difference between incontinence and what's the other one? Erectile
dysfunction.
Well, we'll do this one's for the men.
Yeah.
Oh, I was wrong. Incontinence. Thank you. I put an extra C in there. Incontinence is the involuntary leakage of urine due to poor bladder control. So women also, I guess, can have that. Yes. And then erectile dysfunction, obviously, inability to get or maintain an erection. Okay, so that's how it manifests, I guess, for men. Okay.
Yeah.
Around 1 in 3 women, according to the American Urogynecologic Society, wow, this is really testing my pronunciation abilities, experience pelvic floor dysfunction at some point in their lives. So that's what we're going to learn today is what is pelvic floor dysfunction. So 1 in 3 women worldwide. Urinary, here it goes, incontinence affects up to 50% of women, especially during exercise, pregnancy, or postpartum, but mostly assume that it's normal. It's not normal. And apparently there's ways that you can prevent it. Or maybe,
just thought it was a way of life as we aged.
Totally.
Pee
yeah.
in your pants.
Yes. Yet another thing that we had to deal with.
Yeah.
Okay. So pelvic floor dysfunction is not just weakness. It can also be too tight, which can cause pain, constipation, or painful sex. So like your muscles are too.
I don't know if I can say this or not, but I do know someone who had that issue where every time they had sex, it was so painful because it was too tight. And there was like well, I guess we learned this with the libido fairy with Hannah when she was saying if it hurts, it's because there's many tears happening when you have sex. And I think that was what her problem was. So she thought something was super wrong with her and just like never had sex at once and was like, I can never do this again. It was so painful. And then went to see a doctor and then I think she sorted it out. But yeah.
Well, that's a bummer. And then I wonder if maybe those micro tears happen because your muscles are too tight and maybe that's your pelvic floor is actually too tight. And what does that mean? And how does that happen? And what can you do?
I don't know.
I don't know. But so it's not just weakness. It's also
too tight.
Okay. Pregnancy and childbirth are major contributors, but pelvic floor issues also affect women who have never had children. So it's not just a postpartum or a pregnancy thing. It can affect all women. Chronic stress and anxiety can contribute to pelvic floor tension, meaning your mental health directly impacts your physical body. I mean, unsurprisingly. I mean, this is also probably TMI, and I don't know if this is related whatsoever, but I found during like a period of deep grief several years ago that I got really constipated. I don't know if this is okay to say on the internet.
Interesting.
But I think just like the physical stress and like anxiety held in my body, just like nothing was flowing. So
is this when you were also trying to figure out your gut health and stuff like that? And you were like, there's a lot going on. I remember this.
Yeah. I went to acupuncture. I did all the things because it was just not. So I wonder then if chronic stress and anxiety, contribute to pelvic floor tension, which then can lead to constipation. So I want to get into that because that's actually been an issue many times.
True. This may be a hard one, but maybe we can decide whether or not to do this. But I feel like grief would also be a good one to cover.
Yeah. Exactly.
But maybe too hard next season.
Down the line. Yeah, exactly.
Season down the line. Yeah.
Many women, Kegels. Many women are taught to do Kegels. Like, when's the first time you heard about a Kegel?
Honestly, younger than you would think. I feel like I was like taught like preteen, like 12 or something like that. Because I feel like it's something that's on TV often. They like joke about Kegels, and then you're like, "What's a Kegel?" And then sometimes I just like randomly do it. I'll just like sit, like I'm doing it right now. I'm just like,
ladies,
Kegeling away. Yeah.
Not Kegling away. Yeah. I agree. I feel like it was always in like a movie with like older women or whatever, and that's how you learn. So it says many women are taught to do Kegels, but are doing Kegels incorrectly. And doing Kegels incorrectly or when you don't need them can actually make your symptoms worse. So I don't know. What does that mean? How do we know? How do we know all this stuff? That's what the Vagina Whisperer is here to tell us. Okay, a couple more. Interesting. Pain during sex, which is also known as dyspareunia, is often linked to pelvic floor dysfunction, yet it is massively underdiscussed and undertreated. Agreed. Okay. I feel like women just like suffer through it or think like something different is wrong with them. But apparently it seems like maybe there's like some things we could do. Okay, last two. So most women are never taught how to properly relax their pelvic floor, despite the fact that relaxation is just as important as strengthening.
There's too much in the world for us to know. It's too much.
I know, but we should be taught this in health class. Like when we go through puberty, we should know like what this even, the fact that none of us even know what pelvic floor was.
Totally. Also, it would be less overwhelming now if we were taught this at an earlier stage. I feel now I'm like, obviously while we're doing this podcast, I'm inundated with information. I'm like, how will I retain it all?
I didn't know I was doing Kegels wrong as well, but I guess we'll find out. But to that point, actually, around education, final fact is that the global pelvic health market, therapy, devices, and treatments is growing rapidly worldwide, yet education on the pelvic floor is still largely missing from standard health curriculum. So, of course, we're being sold all these treatments for it, and we're being told that we're doing everything wrong and that we need to change it, but we were never taught what it is or how to do it in the first place.
Okay. Speaking of being young and health things, I also want us to do an episode on peptides, because what the fuck is a peptide? Apparently, teenagers are taking them like crazy. They're like stacking peptides and buying like special peptides mini fridges. I'm like, how do they learn about these things? We didn't learn about this in class. TikTok. Interesting.
TikTok. Robin knows like all the peptides. My best friend who's chronically on TikTok knows, and like basically borderline Gen Z knows everything about the peptides. She knows like GL4, 5 glucogen, whatever. I don't even know what a peptide is. Where is it?
Me neither. In your body? I don't know. Another episode. Watch this space.
Okay, should I introduce our expert, our actual expert today? Okay, Dr. Sara Reardon is a board-certified pelvic floor physical therapist, founder of the Vagina Whisperer, and author of Floored, A Woman's Guide to Pelvic Floor Health at Every Age and Stage. Through her clinical work, digital education, and viral content, Sara has helped millions of women better understand their bodies, from peeing when you laugh to painful sex, postpartum recovery, and everything in between. She's on a mission to normalize conversations around the pelvic floor, aka the muscles we were never taught about but use every single day, and to give women practical, evidence-based tools to feel stronger, more confident, and more connected to our bodies without shame, fear, or confusion. Love.
As good as that description was, you reading it was even better.
And we can't wait. Let's bring her on.
Yay! Woohoo!
Please note that this pod is for educational purposes only. Nothing we say should be taken as financial, legal, or medical advice. Please do your own research, and when in doubt, ask an actual expert.
Thanks for joining us. We're so excited to have you. We call you Dr. Reardon. Dr. Reardon.
Sure, welcome. And Sarah's fine too. Whatever y'all are comfortable with.
Amazing. Okay, we're so excited to have you. I'll give you, like I said, a little bit of a brief on how this works, and then we'll kind of launch into it. So welcome to Actual Experts. The way this typically goes is that one of us leads kind of the episode and the questions. I've done the research for this episode, so I prep all the questions and do a little bit of research in advance. Then the other one, who's Caitlin in this case, comes in what we like to say as blind, because she represents the list of them, and so she knows nothing.
Okay.
Yes.
Okay, great. That's interesting.
Absolutely nothing. Lundie read off some fun facts beforehand, and I was like, I'm like, this is all new to me. So we're very excited for this episode. Yeah, it'll be great.
Yes. I know. And although I did the research, I know probably not much beyond nothing, which is so crazy because this is like an essential part of our bodies. And so
I know.
Yeah, we're excited to learn from you, and we'll get into it. In our intro, we were talking about at what stage are we supposed to learn about the pelvic floor, and I was saying, fiance, he was like, this is such a niche topic, the pelvic floor, and I was like, that men also have a pelvic floor. Like, I don't think anyone.
I know. Isn't that wild? I wrote my book Floored last year, and I was like, the number one question I got from women and moms was, how do I teach my kids about this? And I was like, that's the next book. Like, how do you, like, teaching your kids about this? Because we don't learn, like, we learn about, there's books about periods and even pooping, but like not pelvic floor health.
Yeah, totally. So exactly. Let's get into it because I have lots of questions. So first and foremost, we did a little bit of an intro to you and read your bio, and we mentioned your book Floored, but you're also the founder of the Vagina Whisperer. And so we want to get into a little bit about that. First of all, love the name. Much needed. And tell us about that and what led you to found that, a little bit about your book before we get started.
Well, I have been a pelvic floor physical therapist for 19 years. And when I was pregnant with my second son, about 2016, I was pregnant around the same time as a lot of my girlfriends. And we were, sending text messages and emails about different pregnancy supports or postpartum exercises. And I said, you know what, I'm just going to put this on social media, create an Instagram account so that if y'all need it, it's like there for you. So I don't have to keep writing the same emails or text messages over and over. And they came up with the name, the Vagina Whisperer, years before that, because every summer we used to get together and have a big, like, pool weekend together at a friend's house outside of Boston. And I would end up in the hot tub talking to their moms about their bladder issues. And they're like, Sarah's in her like mid-20s and she's talking about like leakage and hysterectomies with all the older ladies. And I was like, yeah, this is what I do. And so they came up with the nickname, the Vagina Whisperer. And since the social media account was really for that community, that's how I named it. And, the growth of that social media account over the past 10 years, it's, at almost 750,000 followers now, is really a testament that women want and need this information and we're not getting it from anywhere else. And so it's really incredible to be able to be a resource for women at every stage of their lives talking about the pelvic floor.
Totally. I mean, that's how we found you. First of all, the name stands out, obviously, but your content's incredible. So excited to get into it. Let's start with what we typically like to title our episodes, which is What the Fuck Is. So in this case, what the fuck is the pelvic floor? Where is it in our body and what does it actually do?
The pelvic floor is a group of muscles that sit at the base of your pelvis. So if you can imagine, the pelvis is that ring of bones we see on skeletons, like at the bottom of the spine or even on like little kids' pajamas. At the very bottom of that is literally a floor of muscles. And those muscles support your pelvic organs. So in the female body, the uterus, the ovaries, the bladder which holds urine, the rectum which holds poop, all rest inside of that basket of muscles. And the muscles in female bodies have 3 openings, one for the urethra where urine exits, one for the anal opening for bowel movements, and then the vaginal opening for vaginal birth, menstruation, and vaginal intercourse. Male bodies have 2 openings, the urethra and the anal opening, obviously no vagina. So these muscles are working for us all throughout the day, whether we're like holding in pee and poop or exercising or lifting our kids or, even just sitting straight up in a chair. It coordinates with our spine and our breathing. So they're so important to our everyday function and our reproductive health and our core support, but yet we don't often learn about them until we're having a problem. And that's really where I want these conversations to be more open and common so we know what the normal is. And then if we have an abnormal symptom or situation, we know how to handle it.
Makes total sense. Okay, interesting. And so you touched on then us never being taught about this and Pam saying, how can I teach this to our kids? So why do you think, I mean, you may not have an answer to why our curriculums don't currently talk about this or cover it. And at what point do you think all children, specifically maybe women, but all children should be introduced to the pelvic floor?
I think that the narrative for my generation, I'm 43, and particularly the generations before me, was that we don't talk about this part of our body. It's given nicknames, so we don't even use the real terminology like vulva and vagina and pelvic floor. We call it like a cookie or a cha-cha or whatever kind of pet name. And we're told like, oh, don't say that, or like, don't say the word vagina, or like, don't talk about it, or don't touch down there. And so we're taught to kind of be embarrassed and ashamed about it, and therefore we don't speak about it. The other thing is that, women's health, we know, is significantly underfunded and under-researched in this country. There's a huge gender bias in research and medicine and care for women. And because we don't know about it, my parents' generation, my generation, we can't educate the next generation. And so I think that that's really where the tides are changing, is that if we know better, then we can teach our kids better. And I feel like that's what the moms of today are doing, is having these open conversations, teaching the real language and how to use, the right terminology for body parts so that we're not living in shame if we have our periods or if we leak a little pee or if we have a problem. We don't just suffer in silence anymore.
It is crazy. As you're saying that, I was thinking that, yes, moms and parents should be educating it, but it's almost like the default is that we have to do it because our school system isn't. Like, it feels like it should be part of health class, but it's not. And so it falls on the shoulders of parents. And that is like a whole other topic.
Right. I mean, you're totally right. And it also depends on culturally what is, appropriate to talk about regionally. I mean, I live in the South in New Orleans, so what kids are being taught here about periods and sex education is going to be different from what they're learning in New York or California. But it does fall on the shoulders of parents. And I think that that's really the case for everything. I mean, as a parent myself, what I have learned is I have to be the advocate for my kids, and I also have to be the advocate for my own body, my own health care. And that's, I think, what we're learning is we've always thought like, oh, they're going to tell us what we need to do, or we're going to, if there's a problem, they're going to tell me how to get help. But that is not the case. And that has been the case with pelvic floor problems, is that people didn't know pelvic floor therapy was an option for a lot of these really common experiences for women. And that's what the Vagina Whisperer account has been doing, is be like, hey, you don't have to like just deal with painful sex or peeing your pants when you run. There's actually something that can help you.
Totally. I mean, that's something, it's been a common thread through this podcast, which we started late last year. The whole concept is that knowledge is power. And the more that women especially know about our bodies, finance, how the world works, the things that we deal with every day, the better we are exactly able to advocate for ourselves. So this falls directly in line with that. Okay, and then speaking of kind of education, what we're supposed to know, Caitlin and I were laughing. We were like, the only things that we kind of equated to the pelvic floor, I guess, growing up were Kegels, because we're kind of like, I guess in pop culture, Kegels are like almost like brought up as a bit of a joke, I feel like, in movies and TV. And then our moms like peeing their pants when they were laughing. And like those are the two kind of things. And it sounds like it sounds like those are normal well, Kegels, a little bit of a separate topic, but like peeing your pants while you're laughing at maybe after having given birth, it sounds like it's a really normal experience, but maybe not a healthy one, or like one that you should be dealing with.
Yeah, I mean, that's exactly right. Is that one, the narrative has been like, do your Kegels, do your Kegels. And a Kegel is a pelvic floor contraction. It's closing the urinary and anal sphincter, like you're holding in urine, holding in gas, like tightening the vagina. And again, that kind of goes back to like, oh, we're just supposed to have tight vaginas, right? Like that's not the only function of this muscle. But the other thing is, it's the equivalent of saying, oh, if you have back pain, just do a bunch of crunches. Like there's so much more nuance as to why you're having a pelvic floor problem than just tightening. And a lot of women actually have pelvic floor tension. And so if you're doing Kegels and that's not the right exercise for you, it could actually make your pelvic floor problem worse. So one, Kegels are like just an archaic way of talking about the pelvic floor, and it's so much more nuanced than that. And then second, leakage of urine is common, but it's not normal. And actually, it can happen at any stage of life as a woman. I mean, there are school-aged girls who play volleyball, tennis, basketball who leak urine. 25% of female athletes who have never given birth leak urine. It definitely gets worse after pregnancy and birth, and the more births you have. And then it gets even more pronounced later in life when you hit menopause, because your hormones are changing, and that contributes to pelvic floor weakness. But what's interesting to me is that at every stage of life of a woman, your pelvic floor is changing, but we're not being proactive about addressing those changes. We're just kind of saying like, oh, that's going to happen. You're a lady, leakage is normal. But again, there's something you can do to not only prevent it, but also improve it if it's happening. And I think why that's important is women are getting urinary tract infections. They're falling out of sport because of leakage. They're stopping exercising. It's one of the number one reasons women stop exercising is because they can't hold their bladders. And women are ending up in nursing homes later in life because of leakage. And I'm like, this is something that's preventable, but we're not addressing it. And it's really a disservice to women.
That is so interesting, because it's so true. You think of like, when does someone need to leave their home at an older age? And it's like, if they have to wear elderly diapers or mini pads or whatever it is, it's like that sign like, oh, you're children or you don't have a caregiver that can help you change those things. Because my question was going to be like, why is it important? Like, why does it matter? We're talking about it, but this is so clear.
Yeah, it is. And then, there's such great conversation now around like why we need to strength train for muscle health and bone health and joint health. But I'm like, also pelvic floor health. Like these muscles are essential to everyday function, not just like sex and even leakage. So we have to train these muscles like we would train every other muscle in our body.
Okay. All right. So we're going to get into it. We're going to get some practical advice, hopefully. But before you can identify, I guess, how you treat or strengthen your pelvic floor, are you looking for signs that your pelvic floor might not be functioning properly? Like, are you looking for signs that it's weak? We mentioned, obviously, leakage, painful sex, constipation. Almost seems like the inverse, maybe, but is that also okay?
Yeah, totally, Lundie. So these are muscles like every other muscle in your body. They can be weak. And that means they're not contracting well when we need them, which could lead to core weakness. Like a lot of women during pregnancy and birth have what's called diastasis recti, which is a separation of the midline of their tummy, and that doesn't come back. So like core weakness, urinary leakage, fecal leakage, like not being able to hold your bowel movements, staining in the underwear, weak orgasms, decreased sensation with sex, pelvic organ prolapse, which is when that basket of muscles isn't like supporting those organs as well, and it starts to feel like something's like pushing into the vagina or falling out. So there's a lot of weakness signs. Other signs of tension. So again, if we think about how muscles can be weak or tense, these muscles can also be tense. Like I get really tight neck and shoulder muscles from working over patients or kind of hunched over my computer or phone, and I get headaches and I have to do acupuncture and stretching and yoga. Well, when you have tense pelvic floor muscles, you may not be able to start your urine stream or empty your bladder well. You may have to pee frequently during the day, like you feel like you go and then you're not empty and you have to go again. Constipation, straining with bowel movements, hemorrhoids, fissures. Again, pain, so painful sex, but also like tailbone pain, deep hip pain, vulvar pain, vaginal pain, pain with sitting. Anything where we kind of think about tension in the area could also be a pelvic floor issue. So again, I think we don't always think of muscles as the culprit for some of these things, but they're definitely a piece of the puzzle that we want to investigate.
So interesting. I'm like thinking back to all my lower back pain that I like equate to just like sitting weird, but I'm like kind of thinking like maybe it's all related, or like I have a friend who has chronic UTIs, like
Yeah.
UTI constantly. And it sounds like maybe that could be related to like the passage of urine, like getting it all out, maybe. Like
It could be. I mean, and in those situations, it's a little bit of the chicken or the egg because it's like you can have chronic urinary tract infections, but if you're in pain from those infections, like what do our bodies do when we're in pain? We tense up, and then that could cause vaginal pain, vulvar pain, and worse emptying of the bladder. So it's kind of these interesting cycles that we try to intervene as the muscle specialist to say like, okay, let's address the muscle piece and see how these symptoms get better.
So how do you know if you have weak or almost too strong? Like how do you diagnose that?
It's a great question. So if you see a pelvic floor therapist in person, we do an intravaginal or intrarectal muscle assessment. So the way we evaluate these muscles is through an internal exam. So you're like comfortably undressed from the waist down, you're covered with a sheet, kind of like you're at the gynecologist's office, but not nearly as, I don't know, like hospitalish, There's no like stirrups or whatever. And so we insert a finger into the vaginal opening and we say like squeeze around my finger to check your muscle strength, relax to check the relaxation. We press on the side walls of the vagina to see if there's tenderness or tension. And then we ask you to like push your bear down to see if there's any weakness of the walls and that you can coordinate these muscles well because a lot of people don't know how to contract or do a Kegel or relax and bear down. So some of it is just connecting mind and body and teaching people how to do that and then doing the evaluation. But if you're listening to this at home and you're like, well, do I have to see a specialist? It's always the ideal way, but there are, like in my app, the VHive, I have a quiz that you can take that kind of asks you your different symptoms and life stage. So you can see like, do I likely have weakness or do I likely have tension? And it gives you a pathway to walk down to address it.
Love that. We'll definitely be linking that in the description when this comes out. That's very helpful, very cool. Okay, amazing. So that's kind of initial signs that your pelvic floor may be not functioning properly. And I spoke about a little bit like posture, holding your pee for a long time or not exploiting all your pee. So what everyday habits might we be doing that might be contributing to making your pelvic floor worse?
So think about the things we do kind of day in and day out that the pelvic floor is connected to. So peeing, I always teach people how to pee properly. So you should be sitting down when you pee and not hovering over the toilet. So it's okay to do that every once in a while if you're in like a really gross bathroom, but as a habit, I know she's like, Lundie's like calling me out.
I like refuse. I'm always hovering.
Squatting.
Like, always squatting. And not at home.
I mean, if you can sit, like line the seat of the toilet, because if you hover, you don't relax your muscles well to empty your bladder. So if I'm like at a festival and in a porta potty, I'm hovering. But like at a friend's home or like even at my kid's school, or if it's not so gross, like I'll sit because you want to relax the muscles to empty your bladder. So sitting when you pee, not pushing when you pee. I think as women, we are notorious for trying to be like efficient and fast and get to the next thing really quickly.
I always do.
Yes.
I've got to like run out of the bathroom. Like it's a release valve that I'm pushing out. It's every single time. My husband is always like, Caitlin, that was the fastest pee I've ever experienced. I'll be like in and out faster than him. And he's like, I don't even have to take my pants off. Like what is going on? What is going on in there? Yeah.
So when you're pushing, you're actually, stop, because what happens is the bladder is actually a muscle that pushes for you. So you don't have to push. If you sit and just breathe, like lean forward on your elbows, take some deep breaths, your muscles will relax, and then your bladder pushes the urine out for you. So when you push and kind of make it go faster, you're weakening your pelvic floor, you're straining your pelvic ligaments, and that can cause weakness over time. And this is how people end up with like leakage. Yeah.
Yeah. Every time I've ever peed, I'm pretty sure I've pushed it out. I think, right? Like just.
So just sit, chill, breathe, and then just like let it flow.
Okay, I have a question on that. You know those little stools that people put in front of their things for pooping? Is that as used? Because now I always put my feet on my toes so that they're like propped up in the air when I go to the bathroom because I don't have a stool. So is that good for peeing? Squatty potty.
Squatty potty. So the footstool that you put under your feet for pooping is essential for pooping. For peeing, it's only really necessary if you're like pretty sure, like if my kids have to sit down to pee when I was potty training them, or if you have a hard time relaxing your muscles to empty. So if you do have like that tension issue where you can't start your stream or you don't empty well, then I tell people like use the squatty potty under your feet to pee. But otherwise you can just put your feet flat. You just need to be sitting down. So you don't push when you pee, you sit down when you pee, and then you only pee when you have the urge to go. So don't delay the urge. Like if you have to go. Don't overhold it. Like a lot of us who work in a medical setting or a teacher, you can't just like always walk away, but you try to not to hold it too long. But also don't go every time you pass the bathroom, because then your bladder is going to like learn to have to go every 30 minutes to an hour instead of what's normal to pee is every 2 to 4 hours during the day.
Okay. See, I don't think of my bladder as a muscle. Like that makes so much sense that you're training a muscle, just like it's like an exercise in a way.
Yeah. But again, like we're never taught the normal. So like you didn't know to not push when you pee and you didn't know to sit down. So if these are habits we learn early, then you're just like, oh, well, this is the right way to do it. And then you know better.
So doing these things will help then prevent later on the leakage or issues with your pelvic floor. That's the goal.
It can take away one of the risk factors that contributes to pelvic floor problems.
And what's that risk factor?
Like the risk factor is like if you are constantly pushing when you pee, that can weaken your pelvic floor. And we pee 6 to 8 times a day. Yeah. So like avoiding that pushing is going to help in the long run.
Oh my gosh, I'm going to have to change everything.
I can't tell you how many people are like, Sarah, every time I pee, I think of you. And I'm like, all right, well,
great.
I'm doing my job.
Add me to the list.
What a I know. The only time I've ever had any, an experience with this was that I was at the gynecologist and I was getting a scan. What do they call it? With the little wand. And she actually said, she was like, there's your uterus and there's your bladder. And she actually said, you didn't make sure that you're expelling all your urine, because I can see actually from the ultrasound that there's old urine in your bladder. There was like little specks. And I was like, oh no. I was like, I'm not expelling. So then I feel like I'm like pushing, because then I'm feeling like I have to get out. So it sounds like I need to just like chill.
And then there is this technique called double voiding, so that if you're like peeing and you're like, oh, I don't know if I got it all out, or then you like wipe, stand up, but then you sit down again. And without pushing, you just sit, breathe, chill, see if any more comes out, maybe wiggle your hips, and then wipe and walk away. So practice that double voiding, but eventually your bladder will be able to kind of empty better as you're also working on your muscles, like if you have tension by doing like yoga and breathing and things like that. And then pooping is another thing that we teach people how to do properly.
This was going to be my next question. I was going to ask, are your poop muscles also part of your pelvic floor?
Yes, they are. They are. So your rectum is like a canal. It was so funny. I was explaining this to my kids the other day, and I was like, wait, like this is dinner table conversation. We're talking about sharding at dinner. And I was like, do you want to know why that happened? And they were like, sure, Mom, tell us. I mean, they're like 9 and 11. They're like, oh, Lord, can she like just stop already?
Please, as if we are children.
Yes. And also please tell us about sharding, because I would also like to know.
So your rectum is like the end of your colon, and then it goes into what's called the anus, which is like a hangout area for your poop. And when poop gets to that area, it's like, hey, body, I've got something that needs to empty. And then the anal opening is part of the pelvic floor muscle. So that butthole, that sphincter is your pelvic floor. So that's like getting tight to hold things in, holding gas, holding stool, all those things. And then when you go to have a bowel movement, it needs to relax, just like your urine sphincter. But the squatty potty, or putting a stool, like a step stool, under your feet when you're pooping, puts you in a squatting position. And that is the best posture to relax your pelvic floor muscles for pooping. So if you think about when you see women like give birth on TV, their like knees are hiked up to their shoulders and they're like hugging their knees, because that's like a squatting position and it relaxes the pelvic floor. If you're ever in nature and you squat over the ground to pee or poop, it relaxes the pelvic floor, because that's the best posture to relax these muscles. So we try to facilitate that with the poop stool under our feet. And every time you poop, you should use it. Or if you don't have one, like Caitlin, she just like intuitively knows, you lift your heels up. Because the goal is to get your knees above your hips and then you lean forward. The good news is for pooping is you can push. So you can kind of push when you're pooping, but you don't want to hold your breath. So I always tell people like push, but you want to exhale like you're blowing out 50 birthday candles. So you're not straining, you're just pushing, but exhaling as you do it, and that can help you empty the tank better.
Like a yoga breath.
Sure, yeah. Or like for my kids, there's little plastic twirly straws. I like keep those in the bathroom. And if they have to like strain, I'm like, okay, buddy, like breathe, like blow through this straw. And that makes them like not hold their breath, but they're still bearing down.
Never knew. Never knew. We're not allowed to talk.
No.
Never knew. Honestly, I'm learning a lot about my daily habits, let me tell you.
Yes.
Okay, so then when it comes to, like you said, having habits, healthy habits that can prevent the risk factors, let's talk about Kegels. What the fuck is a Kegel and what does it do? And how often should we be doing them, if at all?
So a Kegel is, as we mentioned, a pelvic floor contraction where you're kind of closing that urinary and anal sphincter. Some of the ways that I help coach people to do this is I say, okay, you're going to sit up nice and tall. You don't want to be like hunched over. You can do it lying on your back. You can do it in standing, just not like slouched. And then you want to take a deep breath in. So take an inhale. And on the exhale, think about sipping up a smoothie with your vagina. So it's like a sip up. No.
You sip up while you exhale?
You sip up with your vagina while you exhale. So inhale and then exhale and sip up with your vag. And it's like a lifting of the vagina, right? Like you feel it lift from the seat below you. Yeah. So it's not like a squeezing and tightening. It's not like we always think about like tightening your whole butt or whatever. It's not that. It's a lifting. It's a squeeze and a lift. But you also want to relax afterwards. You don't want to just hold it tight. It's like doing a bicep curl. You don't like just walk around with your elbow bent to strengthen your bicep. You have to relax it too. So that's a Kegel contraction. You want to do this during activities that you need it. So you don't have to do like your 3 sets of Kegels every day. Like do it when you're working out. Do it before a cough over a sneeze. Like use the muscles when you need it, but you don't need to be sitting in your car doing Kegels all the time, because again, you might not have a problem or you might have tension and it can make the issue worse. But if you do have pelvic floor weakness, which kind of is related to some of the symptoms we talked about earlier, doing these contractions along with other exercises like squatting and lunging and lifting weights and planks and push-ups will strengthen those muscles over time, and that will give you more support in the long run. But you can't just like sit in a chair and do Kegels all day, because that's not when you're leaking. You're leaking when you're running and lifting and all those things. So you have to use the muscle and train it for what you need it to do.
Interesting. Okay, that makes total sense. It's like you're training the muscle to be strong when you need it to be its strongest, basically.
Right. And it's like, if I'm a runner, I'm going to need different things for my pelvic floor, like endurance and a lot of single leg stand stuff, because that's what running is, versus if you're a heavy weightlifter, like you don't need like as much impact, but you need a lot of that power because you're lifting heavy weights and you need to look at your posture and your breathing. So again, there's so much nuance to this. It's not just do your Kegels, just like we can't say like do crunches and your back pain will go away.
Right. I mean, because quite honestly, growing up, I would first of all love to know where the name Kegel came from. I'll
tell you.
Okay, good. Okay, let's start with that. Where did the name Kegel come from?
Yeah, so there's a gynecologist. His name is Arnold Kegel, a male, who in the 1970s did a research study testing women's pelvic floor strength after birth. And he used a device to do that. And he named that contraction a Kegel, of course, after himself. Yeah. And I think that they need a total rebrand. In my book, I'm like, we should call them puss-ups. Like it's, it's an actual like, contraction. Yes. But that's the name. But they're really pelvic floor contractions is what it is, just like a bicep contraction. So it's a pelvic floor muscle contraction. So
Kegels named after a man. Go figure.
After a man. Yeah. Just like there's so many things that are named after men related to a female body. It's clearly biased. But again, men were the ones who were leading medicine back in the day. And these are all kind of artifacts of just that old time that we really need to kind of, again, rebrand and move forward.
Totally. I mean, and on that note, I was going to say, I think growing up, Kegels were equated to, honestly, I feel like do your Kegels so that you're tight, so that you men want to have sex with you. Honestly, like what awful.
It's disgusting. And it's
culture.
It's disgusting. But it goes along with like how little we knew about our bodies, right? We're not educated about them. How much we sexualize this part of our body when it actually has so much more function than that. Right. And that it's just been the narrative of like, oh, that's what women need to do. That's what they're here for. And it's all wrong and old and outdated. And that's why I love having these conversations, because I'm like, okay, we can actually learn about our bodies and how they work instead of like reading a magazine article that says like that's what we're supposed to do.
Totally. Yeah, like Cosmo in the you know, 80s, 90s. I can only imagine. But I'm so excited to read your book because I feel like this is the kind of rebrand that we all need. Okay, so speaking then about women at different stages of our lives, I do want to talk a little bit about pelvic floor in relation to pregnancy, postpartum, and like fertility, because it seems pretty heavily related. So how does the pelvic floor impact fertility, if at all? I'm curious. And then pregnancy and postpartum recovery, maybe those three stages.
Yeah, I love that. So fertility itself is unrelated to the pelvic floor. Kind of fertility is related to kind of the symphony of hormones and cycles. But I will say the way that we see a lot of women having some fertility challenges is if you have endometriosis, which is a chronic menstrual pain disorder. It's a disease, and fertility is impacted by endometriosis. And a lot of women come see us for painful sex, painful bowel movements, but painful periods, and it's really endometriosis, and that is a contributing factor to their fertility. The other thing is if you're not able to have sex, you obviously are going to have a hard time getting pregnant. And I've had many women come in, whether they've had sex previously and now it's painful, or they've never been able to have sex because it's painful, and now they want to get pregnant and they're like, I can't do this. And the stories I have over the past 20 years, like I've had people insert candles into their vagina to try to like open it up. I had a woman insert semen through a turkey baster because she couldn't have sexual intercourse. I've had people have to get surrogates because they can't tolerate insertion to the vagina. I mean, the struggles that women have behind closed doors are very real. And I'm like, this is a muscle spasm. Just like I get something in my neck and shoulders and I get a headache, but yet they have never been guided on how to address it. And when you go to the doctor, it's like, use more lube, drink a glass of wine, just be less anxious, don't worry about it so much. And this is a real medical issue. And so I absolutely love working with that population because I think that it's so impactful to be able to see someone to, it's not even just sex for pleasure, but it's really to grow their families and changes the course of their lives. So that's kind of the fertility aspect. Now, pregnancy is one of the biggest physical transformations you will go through in your life. And this is where I think that pelvic floor therapy needs to be proactively implemented for women, because your pelvic floor is getting weaker and longer and less supportive throughout pregnancy. So whether you have a C-section or a vaginal birth, your pelvic floor is changing. When you're pregnant, you always get these little text messages or emails that say like, your baby's the size of an avocado, then it's the size of a papaya, now it's the size of a watermelon. Well, if you think of this muscle like a hammock that's supporting your organs, when you have an avocado in a hammock, it's not going to like change that much. But if you put a watermelon in a hammock, it's going to sink and stretch lower and have a harder time supporting you. And that's what happens during pregnancy. So the pelvic floor is weakening and you have loss of core strength, you have weakness, you have leakage, you have hemorrhoids. So we can really start integrating pelvic floor therapy then and helping women learn how to give birth vaginally. Like nobody teaches you, and nobody teaches you how to push. Nobody teaches you how to labor. So we do a lot of childbirth preparation in our clinic. And it's just been so incredible to see women feel more empowered and informed going into that process versus feeling like, oh, well, why didn't anybody teach me how to do this kind of thing?
Totally. That's like a whole other like preparing physically. We have done a what the fuck is birth episode with the doula who is fantastic, Jessica Diggs out of LA, and she was amazing, but we were just talking about like the physical process of birth, let alone like the preparation to labor.
Yeah.
Other episode, which we would love to do. That brings up a question that I had for like kind of our rapid fire around is it called a perinatal massage? Is that what it is?
Perineal. Perineal.
Is that related? Is that
Yeah,
my
totally.
perception is like massaging your vaginal lining? Question
Yeah.
mark? Okay, please
So
explain.
the perineum is the area between the vaginal opening and the anal opening. So it's like the area, we call it the taint. Like it taint the vagina, it taint the anus, right? Or the grundle or the gooch or whatever people call it. So
Yeah.
it's the area kind of between those two, but it's like the grand central station of your pelvic floor muscles. It's like where the pelvic floor muscles all come together in like a figure eight. It's like the center of the eight. So everything kind of crosses there. And when you give birth vaginally, oftentimes you tear or have an episiotomy, which is when they cut to kind of help the baby come out, it goes into those muscles, into the perineum. So if we can proactively soften or massage, and the way that you massage it is to the bottom of the vaginal opening. So if you think of the vaginal opening like a circle, and the top is 12 and the bottom 6, you're going between like 3 to 9 o'clock and like massaging the opening in the last, 6 weeks of pregnancy. And that will help soften that perineum so that there's less muscle tension, there's less resistance when baby comes down the birth canal vaginally.
I can't wait to tell my husband he has to do this for me. I'm gonna be like, Steven, you're about to massage my vaginal opening to prep me for birth.
Some people like it. I mean, we actually have a lot of partners come into the clinic for that session and learn how to do it. And it's a great way for them to become involved in the process instead of like all of the physical onus being on the mom. But I had my husband do it to me during my first pregnancy. And he was like, I don't really like this. And I was like, you know what? I don't like it either. I don't actually need you. So I'm just going to do this by myself, And so it's like, that's okay too.
Also, I don't like any of this, my friend. So like get involved. You're also never taught. It sounds like you might have sons, Dr. Reardon, not daughters, but we're never taught as girls to wipe front to back instead of back to front. I was taught that in adulthood. Caitlin, do you know that?
Yeah.
No, I was taught when I was younger, front to back. My mom was like, don't get that poop up front.
Yeah. No, that was like something I learned much later. I mean, I don't know what I was doing prior, but like it was something that like came as a surprise to me, which is I don't know if that has to be in school curriculum, but that should be.
No.
Add it to the health card.
Add it to the health card. It's funny. There's research studies to talk about that look at if the difference in wiping patterns makes a difference in infections, and it actually doesn't, which is interesting. But I think that a lot of it has to do with it's just cleaning in general. Like if you're and it's all about poop consistency. Like if you're not pooping, like it should come out like one big long sausage, right? But if it's coming out like little chunks of peanut butter or like hard rabbit pellets, like that's where your poop is like not the ideal consistency. So a lot of it has to do like getting your poop like the right consistency so it's like comes out nice and clean versus, hangs out and like goes into these other areas.
Okay, I'm gonna get us back into postpartum, but just on the topic of poop types, brings us to, you mentioned hemorrhoids. Do you mind defining what the fuck is a hemorrhoid?
Yeah. A hemorrhoid is like a prolapsed vein that's in your butthole. So it can be internal above the anal sphincter or outside the anal sphincter. If it's outside the anal sphincter, it looks like, if it's engorged, it looks like a little blueberry when it's engorged because it's a vein that kind of is going into the stretched tissue. And then when it like reduces it's just a skin tag. So that skin tag doesn't ever go away. And this is kind of where cleaning starts to get problematic for some people because they can have to wipe a lot and then it gets bothersome. So, and then if it's internal, it often can cause itching or bleeding. So it's a prolapsed vein. And it often comes from straining. So during pregnancy, it happens a lot because you have so much weight above you and all your vascular walls get really relaxed. Just like women get a lot of varicose veins during pregnancy, the same thing happens in their butt. And so they have a lot of laxity in those tissues. It happens with straining from heavy lifting, from standing on your feet a lot, and also straining during bowel movements. Like if you have a really difficult bowel movement, you'll be like, oh my gosh, I feel like something's coming out of my butt, and it could be a hemorrhoid. So it all has to do with, again, relaxing the muscles well, having soft bowel movements so you don't have to strain, not having pelvic floor muscle tension so that things don't have to it's not like you're squeezing toothpaste through a tube. So it's all kind of a muscular component. Yet in our medical society, we just treat the hemorrhoid, but we don't ever take the step back to be like, what caused it? And so then that's where we come in as therapists to be like, okay, something caused this. We've got to fix that or the hemorrhoid will keep happening.
Yeah, like chronic hemorrhoid. Yeah.
Just quickly on clarification, what's a prolapsed vein?
So prolapse, if you remember, it's like we talked about this just earlier. Prolapse is when something is like pushing into another area. So a prolapse, like your pelvic organs, which sounds very scary, can prolapse. Like your bladder can push into the vaginal wall and it can feel like there's a bulge on the inside of your vagina and it's their bladder pushing in. Or your rectum can prolapse and it's like your rectum is pushing into the vagina on the backside of the vaginal wall and it feels like it's a poop pocket, like there's like poop hanging out in there. So prolapse is like a weakening into an area of tissue. So the vein is like pushing into the tissue and it because there's an area of weakness.
Okay.
It's like a hernia. Have you ever seen like a hernia and a belly button? It's like that. It's just in your butt.
Okay. And it sounds like it's a problem. Like you should fix it. It sounds like you shouldn't just hang out with it.
Yeah. I mean, I have people who have so much pain with bowel movements that they're like, I don't want to have a bowel movement. And then they avoid it and then it gets backed up and then it causes pain. So it's absolutely, and it's like, you can't sit, you can't travel. I mean, it's painful. I've had people have to go get surgeries many times. So our medical system is all like, let's treat the symptom. But in our field, we're like, well, we have to figure out what caused that. And that's why like pelvic floor therapy is such an important piece of all these different aspects because we've got to get to the root cause of like the mechanics that led to it.
Totally. Okay. Makes total sense. I want to jump back quickly just to pregnancy, like preparation and then postpartum recovery, because you mentioned tearing right through figure 8, our perineum, which is the focal point. I'm learning so much of our pelvic floor. So things we can do in pregnancy, late pregnancy, other than maybe a perineum massage to help strengthen the floor. And then things we can do in recovery to maybe speed up our recovery, help.
So throughout pregnancy is 40 weeks. I really encourage women to stay active. Exercise is hands down going to be one of the most important things you do. You can keep doing what you're doing, but as you get more progressed in pregnancy and maybe bigger, you may want to just modify. Like if you're running, you can keep running. If you're lifting weights, you can keep lifting weights. You shouldn't, and you can start a new program if you've never been an exerciser before. The benefits are huge to mom and baby. But I really encourage folks to strengthen their pelvic floors throughout pregnancy because we know that hammock is stretching and lengthening. So being proactive about that, learning how to poop so you're not straining, all those things. And then, around like the second half of third trimester, we work a lot on what we call birth preparation. So we teach you how to push. So we do the perineal massage, making sure that like the internal pelvic floor muscles are not really tight or tense, that you can lengthen and relax them. Because when you're pushing during a vaginal birth, your pelvic floor muscles are not pushing the baby out. Your uterus is. Your uterus is contracting, just like your bladder. It's a muscle. So the uterus is contracting. That's what we call contractions. And it's pushing the baby down the vagina. So we need the vagina to be relaxed and open and like get out of the way so that the baby can come down. So we work a lot on like yoga stretches, breathing, softening the muscles, perineal massage, pushing in different positions so that you can practice these things before you go into birth. And it's like you're going to be running a marathon. Like, why would you not train for it, right? So we help you train your body for that experience.
Totally. I know. It's the fact that, I would have gone in blind. We've learned so much through this podcast, purely, birth, postpartum depression, breastfeeding, things that we haven't experienced yet, but like the amount, and honestly, what it all comes down to, and more specifically, we did a breastfeeding episode a couple weeks ago, And the key takeaway was ask for help. Like
Yeah.
we don't think give ourselves permission, women, so often to ask for help until like we're writhing on the floor in pain,
Yeah.
you know.
bleeding from our nipples, and then we're like, oh, let's go now. Yeah.
And
Yeah.
even then, maybe don't even ask. You know what I mean? So it sounds like, yeah, like ask for help. And I like that analogy. Like you're going to run a marathon. Why would you not train? Like going, I feel like I would have just wung it. I don't know. Like
Yeah.
done my
Most people do. Most people do.
Yeah.
And then we see them for their second pregnancy and they're like, I wish somebody would have told me about this the first time, you
Yeah.
know? And so I think that that's what we're trying to do is educate people sooner. And you know, the asking for help, it's like you absolutely do that. I always say like you have to advocate for yourself. But it's because we have been dismissed for so long. Like we have
Right.
been, like information is being withheld from us. Like we're not taught how to breastfeed. We're not given the support. We're just told like, hey, it's best for you and the baby if you breastfeed. But like, again, that's a skill. That is like
Right.
a class, a course. I mean, you need real support and not just like a 10-minute visit in the hospital and
Right.
a pamphlet. And so it's unfortunate that it does fall on us, but until the system change, like you do have to push and ask for help. And that's the same thing with pelvic floor care. So postpartum, there are some places in the country where you can see a physical therapist in the hospital, which would be the ideal world. But most often we see people in our clinics between 4 to 6 weeks postpartum. And we look at their abdominal walls. We do like a core check. If they've had a C-section, 32% of moms are having C-sections. So a lot of scar assessment and scar massage. And then we do an intravaginal assessment after the 6-week mark or once they've been cleared to do that. And we check their muscle tone and tension and their scar and anything that kind of can contribute to function. And sometimes people are doing amazing and I'm like, okay, go back to exercise, go back to work, call me if you need me. But most often they're uncomfortable and they're like, how am I supposed to have sex when like I can't even have you touch my vaginal opening? Or how am I supposed to like go back to running when I feel like something's falling out of my vagina? Or they're nervous and they don't feel confident in their bodies. So we help them rehab and rebuild their core strength, their pelvic floor strength, adjust their healing to get them back to kind of where they want to be.
Okay. Yeah, so important. You mentioned just one other specific example, when you're pregnant. I don't know if this is related specifically, but when you're pregnant and your abs separate and there's nothing you can do about it. Is
So it's
that
called diastasis recti, diastasis rectus abdominis. So the rectus abdominis are like your six-pack muscles that I've never seen mine, but I've heard that we all have them, you know, so they're there. But during pregnancy, there's a line of tissue down the middle called your linea alba. And that line stretches out to accommodate the growing baby. Like it's designed to do that. That's why it's not like stuck together. But what can happen is that it doesn't just automatically go back together after birth. Not 100% of women experience this, but most do. I would say 60 to 70% of women have it during third trimester, and over 50% have it postpartum. And so what we do is by training your core, your pelvic floor is part of your core. Like when you contract your deep core muscles, your pelvic floor turns on and vice versa. So by doing that training, it helps that tissue at the middle of your six-pack abs kind of start to re-strengthen to help those muscles and tissues come back together.
okay? And would doing like gentle and approved core exercises, like things like Pilates or yoga or weight training through pregnancy, potentially prevent that, or it's like a toss up of whether that happens or not?
It's a little bit of a toss-up because there's so many risk factors. Like some of it's genetics, some of it is hormones, some of it is your activity level. So some of it is which birth it is for you, whether it's your first birth or your third birth. So there's a lot of factors in there. But exercise is great, important. If the diastasis is happening during a certain activity, I usually tell people to modify it. Like if you're doing a bunch of crunches and you see it, I'm like, oh, just do planks, like think about ways that you could modify stuff. But you do want to continue to strengthen those muscles. You don't want to like not do anything, but just finding variations to do it. And it's so interesting because like in my app, the VHive, it's like I created this pregnancy program where it's like the first 2 trimesters, it's a lot of strengthening, but it modifies it based on what week of pregnancy you're in. So it's like at week 20, when they say like stop laying on your back, we're like, okay, let's do core stuff, but in a different position. And then during the third trimester, it focuses a lot on like the relaxation and the stretching and the yoga and the breathing and helping soften everything versus keeping everything so like tight and tense.
Love. I'm so excited. I'm going to tell them. I'm trying to think of none of my friends right now are pregnant, but I'm excited to spread the word about this because I feel like so essential. It's like just all the information you need in one place. So love that. I have two more questions, Caitlin. I'm going to pass it over to you in a second. But my last kind of practical question before we get into the last one is, what are like simple, practical things that women can start doing today to start improving their pelvic floor health? And we talked about sitting while we pee, squatty potties. Anything
Yeah.
else you're aware of?
Yeah, I think just be mindful. Like, start kind of paying attention. Like, when you go pee and poop, be like, oh, am I straining? Am I holding my breath? Like, when you're sitting, or you're like, am I sacral sitting and like tucking my butt under? Am I like sitting up nice and tall and kind of like supporting my spine? Another big one is not using our breath. Like, your breathing actually helps relax your pelvic floor. So, a lot of us who sit a lot or are stressed a lot or tense a lot, we clench our pelvic floor. It's like, I can like pull back somebody's gown in their clinic, their hospital gown. I'm like, okay, this person has like a tight butt, literally, and they're having a hard time pooping. And I'm like, I can teach you how to do squats till the cows come home to stretch these muscles. But if you are in a habit of tightening your body, like
Yeah.
we've got to unwind that. So a lot of this is like working in a whole body nervous system situation where it's like you're doing breathing, you're relaxing, you're taking screen breaks, you're doing things that are calming your nervous system down. And that is going to like help your pelvic floor just have a more neutral landscape versus like super tense or super weak. So I always say that I'm like, if you're just tense throughout the day, like doing a yoga stretch isn't going to do you any good. You have to kind of really think top down. So using some big deep breaths to relax your muscles. And then also when you're exercising, not holding your breath. If you're lifting something heavy, so for me, this was when I was postpartum and I'd be like lifting a heavy stroller into my car, or I'm like traveling and I'm lifting my luggage into the overhead bin. I don't like hold my breath. I exhale as I do it. So I always go
Right.
like, okay, I'm about to lift my son to the ground. I'm like, all right, buddy, 1, 2. And
Right.
because if you hold your breath, it puts pressure down on your pelvic floor. So if you're doing
Okay.
that when you're like lifting weights or even Pilates, then it's like that's pressure down, and then you can't get that good engagement of your muscles.
So that like mindfulness and breath. I feel like in Pilates, Caitlin and I go to the same Pilates instructor, and that you always exhale on your like press out, which is inverted from what you naturally kind of want to do. So that makes a lot of sense. But you mentioned just, and I want to touch on really briefly, like the top down approach for this, which I
Yeah.
don't think we give enough credit to, like the mental aspect of it. I mentioned in our intro that my only experience with like really chronic constipation, so glad this will be on the internet soon, during like period of like intense grief and
Yeah.
like 2 years where I like constipation was so chronic, and I tried I did acupuncture, I tried, everything, and it really was just this like this tensity, anxiety in my
Yeah.
body. I just like could not relax. And so I was saying to Caitlin, I was like, I wonder if that's related. And it sounds like it's really related to like
It
mental health.
actually is really related. So we have a what we call like your autonomic nervous system, and then that has a sympathetic nervous system, which is our like fight or flight, right? That's like we want that to be like, oh my gosh, there's danger, like whatever. And then we react. And then we also have our parasympathetic nervous system, which is our rest and digest nervous system. That's like our chill, calm, and that's when like our bowel movements can happen and we can like relax and release. And so if you have this really overactive sympathetic nervous system, which like find me a woman in today's world that does not, that will upregulate your system, your slow your digestion, tighten your muscles, all of these things. And that's why it's not just like, hey, let's relax your muscles and do this thing. It really is kind of a whole body approach. It's the same thing with headaches. Like I can get acupuncture, but if I'm like tense like this and just like working like crazy, like they don't get better, you know? And so it really is a little bit of like, how do we balance everything from that top down? And it has to do with hormones, it has to do with anxiety. I mean, all of these things, but I think it's important to address that because it does absolutely impact every part of our body, including our pelvic health.
Yeah, such like a mind body connection that again I don't feel like we give ourselves enough grace on. So that's validating because I was wondering throughout that process. Okay, amazing. This has been incredible. Caitlin, any questions before I ask our last question?
Okay, I do have one last question, and I hope it won't take up too much time, but I must know, why do we shart?
No. Amazing
I'm not letting you
question.
get away without that one.
I'm like, this came up earlier and I must know the answer.
So there's two reasons. One, like that sphincter is supposed to hold everything in. And if that sphincter is weak or even tense, sometimes it's tense and it doesn't relax well, that like when you relax it, something is going to come out. Or if you have weakness, it's like it can't hold everything in, right? It's going to seep through. The other reason, this is what I told my kids the other day, is that you have these sensory receptors in your anus that are like, hey, is this liquid? Hey, is this gas? This is why you can relax your muscles and just let gas out sometimes, right? But if those sensory receptors are like not as kind of fine-tuned as we want, sometimes you relax your muscles thinking that it's just gas, and it's not, and it's shit. And shit comes out with the gas. And the softer the bowel movement, the more likely it is to come out. So like if you have a bowel movement that's like as soft as applesauce, that's going to be different than having a bowel movement that's like a lump of peanut butter, right? So if you have applesauce poops, sensory receptors that aren't working well, and a tighter, weak butthole, it's a recipe for a shart.
Oh my gosh. Okay.
Good to know.
This happened to a friend when we were very hungover, extremely, extremely hungover, and it was the most horrifying moment of her life. But it makes sense that
She probably had the runs after drinking.
exactly. She had the alka-poops. She had alka-poops.
Yeah.
And her
and it was-
receptors were not like
We're also
firing on all
drunk.
They were
cylinders.
the hungover, you know.
Exactly.
I mean, they just
Yeah.
were not on top of their game, and she shorted.
Yeah,
It's not
exactly.
her; it's the receptors.
I will
There
let
you
her
go.
know.
Tell her.
Yeah.
That's hilarious and good to know. Honestly, knowledge is power. So we like to close out all of our episodes by asking our actual experts the same question about the topic. So what is one thing that every woman should know about the pelvic floor?
I mean, outside of the fact that they have one, I think I want everyone to know that they do not have to suffer with problems in this area if they are bothersome to them. I think, again, we are just used to white knuckling our way through discomfort, whether it's a little leak with a cough or painful sex a certain time of the month or back pain that we can just kind of, grimace our way through, that there is help and medical help and therapy to relieve the discomfort that you're having and to help you live your best life. I mean, I had a mom in yesterday who had a C-section, and for the first time we were massaging her scar and she was sobbing. She was like, I'm so sorry. I've never done this before. Like I've never had this emotion, but she is holding so much in her body and her pelvis and her abdomen, and to help her let that go. And I was like, girlfriend, get it out. Like this is where you can like release these things because we hold so much and I think we deserve so much. And so I'm like, don't suffer silently. Don't feel like you just have to deal with this. It is never too late. It is never too early. This should be integrated into our healthcare, like going to the dentist. And I think that we just deserve this care to live the best lives that we want to have. And so don't delay.
Love it. Dr. Sara Reardon, thank you. The Vagina Whisperer. Everyone go and follow at the Vagina Whisperer. We're going to put your app in the description so that everyone can find you. Everyone would be lucky in the book and floored, which I can't wait to read. Is it on Kindle?
Yes, it's on Kindle and audiobook and
Oh, amazing.
Book. Perfect. Yeah, we will spread the word to everyone we know. We can't wait to get this out there. Thank you so much for joining us.
Thank you.
This has been great.
Thanks for having me.
And welcome to the debrief, where we discuss things we needed a little more clarity on.
Yay. How are you doing? I mean,
your
your background still looks nicer than my background. I'm like, my messy fridge, this
That's
like
okay.
random plant that's dying. It's fine.
This is like
Oh my God, it looks so nice.
the gallery. I know.
I love it. Where does she put all of her furniture? In
Behind
your room.
doors. Yes. In every nook and cranny, all the closets are full.
For context for people listening, Lundie's sister Riley is an insane artist, and she has a gallery that's in her apartment right now. And that's why Lundie's in a room with no furniture.
Yeah, yes, exactly. If you just got that little tour, Ailsa Gallery in New York. If you're in New York City, come check it out. Okay, pelvic floor. I had a fun
pelvic
time
floor.
re-listening to this. I really enjoyed Dr. Reardon.
I know. She's very cool and fun. And just like, I love people from the South and I love her accent and I love what she's teaching. And we just had so much fun. It was hilarious.
Yes.
Okay. Your takeaways.
Yes.
I have two.
Okay, good. Do you want to go ahead? And then I'll
Sure. Okay. Mine is it's really hard to not push when you pee. I've been trying. It's really hard. Every single time. And then I feel like I need to send a follow-up question, which we probably should have done before doing the debrief. But when you're done peeing, and then I was thinking about what you said, how you like had little like pee left over. And I was like, well, I want to push out the little bits of pee at the end. So can you push at the end or do you just like stand up, sit down?
She said stand up, sit down.
hard.
And she said chill, breathe. Like something, she said something like chill, breathe, relax or something like, I don't know. Yeah, but she said you can stand up and then sit back down and then just make sure it all comes out. But I was laughing because I do think of her now.
Every time I pee, every single time I pee. And every time I pee, I'm like, I'm doing it incorrectly. I'm messing up my pelvic floor. I can't stop pushing. I'm used to like the release valve. It's not.
I know.
It's a training. We're going to get there.
It's a training. It's a muscle. I know. I was actually telling Riley this morning that we had just done this and she was like, you have to ask about peeing when you sneeze. And I was like, well, we actually have already recorded, but it's more normal than you think, but it's a sign of a weak pelvic floor. Sneezing, coughing, jumping.
Remind me, what did she say? How do you strengthen your pelvic floor?
She basically said that it's like when you do it in the times that the weakness shows up. So like if you know that you pee when you sneeze, then try to, I think, to clench and like to strengthen.
And do a proper Kegel.
Yeah, like in those times or like running, I guess you would have to like hold it the whole time.
I guess it's kind of like Pilates, how you engage your core when you do it.
Yes.
So you would need to engage your pelvic floor.
Right, because that's what I was saying was I was like, so it's like you teach it to be its strongest when you need it. You teach it to be strong when you need it to be its strongest, I guess.
Yes.
And then we were just laughing, being like, yet another thing that we have to worry about.
To do.
For me, one of my takeaways was like all the pre-pregnancy chat, like first of all, fertility, like what she was saying about some of her patients who obviously have a hard time getting pregnant because they have such a hard time having sex. And so I think that's like such a takeaway is like if you're experiencing any of those difficulties, like ask for help. But then also that like when your baby becomes a watermelon, imagine your hammock having to support a watermelon.
It's so much.
Including the perineum massage.
Okay. Yes. Oh, I told Stephen after he has to massage my vagina when I'm pregnant. And he was like, no, I'm not doing that. It's like,
he's like,
fair enough.
You.
Yeah.
I'll pass. Thank you. Yeah.
He was like, I'm probably not going to do that for you. I was like, that's fair. This actually made me think when we're talking about all the extra stuff that we need to do, we at work had this like Women in Wealth conference thing, which was very cool this week. But they had a menopause speaker come in and it was in French. So I only caught a little bit of it. So I was like reacting to the women's reactions around me. But then afterwards, my friend told me that, and we have to ask this in our menopause saying, apparently when you go through menopause, women lose 30% of their brain power.
My God. Really? Seriously?
I told my mom, she's like, that makes so much sense.
Yeah, actually, I'm like, that probably tracks. And if women knew that, they would probably feel a lot better about themselves. That should be a widely known fact. Okay, yeah, I have lots.
We'll lock that in. We'll lock it in. Anyways, when we're thinking about all the stuff we have to think about as women, that was just one of the many that I've learned recently.
Add it to the list.
Okay, I have another one. The other one was sharding. Who I feel like when I think about what I took away from this, truly mine were don't push when you pee and why do we shart? Like that.
I was going through editing and I was like, I don't know if we could keep this in here. I was like, this is
100%. We have to keep this in here. It is literally gold. I had to know. And I had to know because I experienced it with my friend, like I said, and she was laughing so hard and we were so hungover and it just happened. And I just needed to know why.
Well, it all goes back to the consistency and making sure that you have the right consistency. It's all connected.
I need to call her. I'm going to tell her, work on your pelvic floor so it doesn't happen again.
I was laughing being like, in my household, girls don't poop in my household. So like the fact that I'm discussing sharding on a public forum is like never thought I'd see the day.
I would never. And we're the exact opposite. I'm like door open and chatting, and I'm like this. Steven's like sitting there. I'm like, what's up?
Oh, I told Luke very early in our relationship that girls, after they go through puberty, they lose their ability to poop, and it just expels through RP because he's one of 3 boys and his dad is one of 3 boys, and so I think he just believes me, and so I
love that for him.
Gotta run with it.
Well, we have a lot of exciting recordings coming up. We have Dr. Lucky for another fertility one, which we actually posted and got some really good questions for. So I'm excited about that. And perimenopause and menopause coming up. So that we're recording soon. So lots of good stuff coming.
Good stuff coming. And retirement planning, which was an early record that we've yet to release. So retirement planning and fishing.
Yes.
And pig butchering. If you don't know what that is, stay tuned.
Tune in.
Yeah. Tune in.
It's a biggie.
It's a biggie. Okay.
Okay.
Cool.
Thanks, everyone. Knowledge is power. Woohoo. LFG. Bye.